Thank you so much for coming today. We're really excited to be offering our first ever Institute for Clinical and Translational Research Learning Health System Program educational workshop.
Great. Thanks, Anne. So my name is Majid Afshar. I am the director for this LHS program.
John Long, IS Vice President on the IS side and one of the UW Health sponsors for the Burning Health System preparation with our system.
Thanks for coming. So if you guys are not familiar with ICTR, it's a long-standing history. This is the Institute for Clinical and Translational Research. It's been a large team here on campus that's funded by the NIH since 2007 to kind of help do translational research and build infrastructure to support our community around that. The only other person I want to introduce that is, I think maybe virtual, is Frank Lau, who is our other dyad partner in IS that has also been part of the leadership team for our ICTR LHS program. So what is the learning health system? Sorry, go back. What's the line? Okay. I'm going to just try keep looking it forward. So first of all, we are a collaboration between our health systems and our School of Medicine Public Health with ICTR. We leverage services that we offer in biostats, specifically even pragmatic clinical trials, digital health with our Clinical Informatics Institute. We do team science. We have experts that facilitate team science planning, dissemination implementation launchpad. We have some of our lead scientists here. Systems engineering, we partner with others like Dr. Barton here. So what is a learning health system? What's our definition of it real quick? Data-driven, implementation focused, and meant to focus on the quintuple lanes, which is what the health system focuses on. They're listed there: health equity, provider well-being, cost effectiveness, patient outcomes, access to care. We follow kind of the federal government's ARC goals on this, which is data tracking to help deliver better practice that are proven strategies, or if there's equipoise in certain types of interventions, which one should we pick? And we do these through really rapid PDCA cycles to kind of do this iterative change to get to the outcome. Our governance, we do have a full-on steering committee of leaders, dyad partners. Some of them are here today between our School of Medicine and the health system. We meet with them quarterly to make sure we're aligned with the goals of both sides, making sure we're meeting the strategic aims. And I'm going to hand it over to John to talk more about the program.
All right, good. Thanks for that, Majid. And thank you all for being here today, but also for everything you do every day for our patients and our communities. And it's been a real pleasure and privilege on my part for the last 4 or 5 years to work with Beth and Majid and the ICTR team and so forth to get this whole thing started. I'm here at UW Health and the medical school, and the opportunities in front of us are really, really big and they're exciting. And so I just appreciate you all being part of that journey. For UW Health, right, this whole topic's a big deal, right? Research-grade analytics and operational speed, and getting the good work that you all do as practitioners into clinical practice and helping to advance those aims that Majid showed, right? And so this LHS has one element of, the overall collaboration between UW Health and the medical school. Based on history, circumstance, I was privileged to be part of helping get all this started. I spent a lot of fun. But back to that one moment, right? Please. So this is what we try to do. This is what friend Beth Burnside, in her term, our virtuous cycle. And we have to always be learning from what we do, and we have to be doing what we learn. And so applying the research rigor and learning, early on in initiatives, and then scaling and sustaining the good work that we do. All right, go ahead. And we do that across various pieces that are important, right, for science and for ICTR and for the health system. So we need the right foundation. Majid and team have worked really hard on those pieces. You all know the steps in the overall process, right? We identify important questions and we align those with priority needs for the health systems. You all help on the research and evaluation, including implementation science, right, along with the work, right? We share and disseminate the results. And then the ongoing important work of how, on the health system side, supported by all of you, right, we scale and sustain this work. And I know we're going to talk more about that throughout the discussion. And there's various care targets and objectives that we go after, like you're all familiar with. And we focus on outcomes. Again, research-ready analytics, operational speed, focus on outcomes for our patients and community. So, she's pretty simple to me, as we tell the story. And again, privileged to be part of it and help support all the great work that you all do. So thanks for the opportunity today.
Thanks, John.